All right, so we've done a lot, right? It's Learning Plan 5. We're getting about midway through. We've talked a little bit about sex, sexology. We've talked a little bit about hormones and the development of our actual body. And then we've talked about our roles and gender. Well, the one area that we kind of ties that together is really how do we respond both physiology, biologically, and then how do we respond socially when sex is on the mind or sex is discussed in our roles within society. So lesson plan 5 is all about sexual response. It's all about the look at how hormones play a role in our behavior as well as our sexual physiology. So you're going to learn a lot about testosterone levels and how that plays into how a person is feeling. It also can play in how they view themselves and what gender they view themselves, as well as their role within society. It also has a lot to do with how they interact sexually. Even a drop in testosterone, which happens after age 40, will cause a man to be less likely to engage in physical behavior, where a woman who has an increased amount of testosterone may be interested in having more sexual intercourse depending on what it is. And there are certain chemicals and foods and things that play all into that. So it's quite fascinating. So we're going to talk about hormones. We're going to talk about negative feedback. We're going to talk about positive feedback, about how that interacts with your body and changes you. We're talking about estrogen. We're talking about menstruation and how that's kind of culturally determined. There's lots of societies that view menstruation as a woman's coming of age. It views it as this obviously the right or the ability to now become pregnant. But then really, how does that look to some societies? Some societies really hush it off and say, not here, you can't be part of certain rituals during that time, and others embrace it. It's a festival type of a thing. So that's kind of a cool section. Talk a little bit about hormone replacement therapy. So you're going to get to see a little bit more of that biology and what happens when we do that. We're going to talk about some other issues like tumors and things that happen to us sexually that can alter us. So I think those are all important, especially working with people in a hospital setting. You're working with people where we think there's a mental illness, but maybe we haven't even checked out and ruled out the medical. So it's really important. We're going to talk about PMS. We're going to talk about toxic shock syndrome and some of that buildup of what happens with us if we don't get the right, levels of things in our body. So again, in this discussion and in this learning plan, you're going to just have your discussion board posts, and there's a little video on the anatomy of arousal. So hopefully you'll enjoy those, and that's essentially Learning Plan 5. Thanks.